Welcome to our comprehensive guide on periodontal treatment planning. In dentistry, a well-structured periodontal plan serves as the blueprint for managing cases and achieving optimal periodontal health. The main objective is to coordinate all necessary procedures to establish a well-functioning dentition within a healthy periodontal environment. Every step should be systematic and thoughtfully planned in advance, ensuring that the patient receives the best possible care. This approach not only improves oral health, but also enhances overall well-being. In this video, we'll walk you through each phase of the periodontal treatment plan, highlighting key procedures and their importance. Let's begin by understanding the sequence of therapeutic procedures and how they contribute to successful outcomes. The periodontal treatment plan is divided into several phases, each with specific goals and procedures. This systematic sequence ensures that every aspect of periodontal health is addressed, from emergency interventions to long-term maintenance. By following this structured approach, dental professionals can manage complex cases efficiently and provide patients with predictable results. The phases include preliminary or emergency care, etiologic therapy, surgical interventions, restorative procedures, and ongoing maintenance. Understanding this sequence is crucial for both clinicians and patients, as it lays the foundation for achieving and sustaining periodontal health. Now, let's delve into each phase and explore their unique roles in the treatment process. The first phase in periodontal treatment is the preliminary or emergency phase. This stage focuses on addressing urgent dental issues that may compromise the patient's comfort or health. Common procedures include treating dental and periodontal abscesses, extracting hopeless teeth, and providing provisional replacements if necessary. Immediate intervention during this phase is critical to stabilize the patient and prevent further complications. By resolving acute problems, clinicians set the stage for more comprehensive therapy in subsequent phases. This proactive approach ensures that the treatment plan begins on a solid foundation, prioritizing patient safety and comfort. Phase 1, also known as the etiologic phase, targets the underlying causes of periodontal disease. The primary focus is on plaque and diet control, which are essential for reducing inflammation and preventing disease progression. Procedures include removal of calculus, root planing, correction of restorative or prosthetic irritants, excavation of caries, and necessary restorations. Additional therapies such as antimicrobial and occlusal treatments, minor orthodontic movements, and provisional splinting may also be performed. After these interventions, clinicians evaluate pocket depth, inflammation, plaque, calculus, and caries to assess the effectiveness of the therapy. This phase lays the groundwork for surgical and restorative treatments. Phase 2, the surgical phase, involves procedures aimed at reducing or eliminating periodontal pockets and improving tissue health. Techniques such as gingivectomy, flap surgery, and regenerative procedures are commonly performed to address deep pockets and restore periodontal architecture. Plastic surgery may be required for root coverage and widening attached gingiva, enhancing both function and aesthetics. Pre-prosthetic surgeries like crown lengthening and ridge augmentation prepare the mouth for future restorations. Osseous surgeries, including resective and regenerative approaches, as well as implant placement and sinus lifts, are also part of this phase. These interventions are tailored to the patient's needs, ensuring optimal outcomes. Plastic surgery in periodontal therapy focuses on improving the appearance and function of the gums. Procedures such as root coverage, often achieved through grafts, help address gum recession and protect exposed roots. Widening the attached gingiva is another important goal, as it enhances the stability of the teeth and supports overall oral health. These surgeries not only restore aesthetics but also contribute to long-term periodontal stability. By carefully planning and executing these interventions, clinicians can provide patients with improved comfort, function, and confidence in their smiles. Pre-prosthetic surgery prepares the mouth for future restorative work. Procedures such as crown lengthening and ridge augmentation are performed to create a suitable foundation for prostheses. Crown lengthening exposes more tooth structure, facilitating the placement of crowns or bridges. Ridge augmentation restores lost bone and tissue, ensuring that prosthetic devices fit securely and function properly. These interventions are essential for achieving successful restorative outcomes and maintaining periodontal health. By addressing structural deficiencies early, clinicians can prevent complications and enhance the longevity of dental restorations. Osseous and implant procedures are advanced surgical interventions in periodontal therapy. Resective and regenerative osseous surgeries address bone defects and promote tissue regeneration. Implant placement and sinus lifts are performed to replace missing teeth and restore function. These procedures require careful planning and execution to ensure successful integration and long-term stability. By utilizing modern techniques and materials, clinicians can achieve predictable results and enhance the patient's quality of life. Osseous and implant surgeries represent the pinnacle of periodontal care, offering solutions for complex cases. Phase 3, the restorative phase, focuses on finalizing dental restorations and prosthetic devices. This includes the placement of fixed and removable prostheses, such as crowns, bridges, and dentures. The goal is to restore function, aesthetics, and comfort for the patient. After completing restorative procedures, clinicians evaluate the response to treatment and conduct a thorough periodontal examination. This assessment ensures that the restorations are compatible with periodontal health and that no new issues have arisen. The restorative phase is crucial for achieving a well-functioning dentition and maintaining long-term oral health. After restorative procedures, it's essential to evaluate the patient's response and ensure that the new prostheses are functioning well. This involves a detailed periodontal examination, checking for signs of inflammation, pocket depth changes, and overall tissue health. Any issues detected at this stage can be addressed promptly, preventing further complications. The evaluation process is an integral part of the treatment plan, confirming that the restorative phase has achieved its intended goals. By maintaining a close watch on outcomes, clinicians can ensure long-term success and patient satisfaction. The maintenance phase is vital for preserving periodontal health after active treatment. Periodic recall visits are scheduled to monitor plaque, calculus, gingival conditions, occlusion, and tooth mobility. Regular maintenance helps detect early signs of disease recurrence and allows for timely intervention. By reinforcing oral hygiene practices and providing professional cleaning, clinicians support patients in maintaining their results. The maintenance phase is a lifelong commitment, ensuring that periodontal health is sustained and complications are minimized. Consistent follow-up is the key to long-term success in periodontal therapy. During maintenance, regular recall visits are essential for ongoing monitoring. Clinicians assess plaque levels, calculus buildup, gingival health, occlusion, and tooth mobility. These checkups provide an opportunity to reinforce oral hygiene instructions and address any emerging issues. Early detection of problems allows for prompt intervention, preventing disease progression and preserving the results of previous therapies. Maintenance visits are tailored to each patient's needs, ensuring personalized care and optimal outcomes. This proactive approach is fundamental to successful periodontal management. Re-evaluation is a critical step in the periodontal treatment plan. It is conducted to assess the tissue response to therapy, including inflammation, pocket depth, and tooth mobility. Clinicians also evaluate patient compliance with oral hygiene practices, which is essential for maintaining results. Based on the findings, further therapy may be planned if necessary. Re-evaluation ensures that the treatment plan remains effective and responsive to the patient's needs. By systematically reviewing outcomes, dental professionals can make informed decisions and optimize care. Patient compliance with oral hygiene is a cornerstone of successful periodontal therapy. During reevaluation, clinicians assess how well patients are maintaining their oral hygiene routines. Education and motivation play a significant role in encouraging adherence to recommended practices. By fostering a collaborative relationship, dental professionals can help patients understand the importance of daily care and its impact on periodontal health. Consistent hygiene habits are essential for preventing disease recurrence and ensuring the longevity of treatment outcomes. In summary, the periodontal treatment plan is a systematic blueprint designed to restore and maintain periodontal health. By following a structured sequence of therapeutic procedures, clinicians can address emergencies, eliminate disease causes, perform necessary surgeries, restore function, and ensure ongoing maintenance. Re-evaluation and patient compliance are integral to achieving lasting results. This comprehensive approach not only improves oral health, but also enhances the patient's quality of life. Remember, successful periodontal therapy relies on careful planning, execution, and collaboration between the dental team and the patient.